All right. Good afternoon, everybody. Welcome. I'm Jeanette Davenport. I'm one of the social workers here with the kidney pancreas transplant team. I'm giving everybody a minute to kind of connect to their audio and join us. Of course, this is our monthly educational offering here in kidney pancreas transplant. We like to bring in some speakers for you to um, talk to you about some important information. So that's who we have here today. We have a few more folks joining us. Looks like everybody's connected to their audio. A couple little reminders, of course. If you could please mute yourself if you're not when you're not speaking, that helps us all be able to hear. Of course, remember we're on Zoom, so if you have your camera on, we can see you and anything in your background. So of course, be aware of that. Um, those are kind of the biggest things. We do record these. We record these sessions because we'll try to upload it to our YouTube playlist for people to watch later in case they weren't able to join. So you should be able to catch it later if you miss anything or if you get knocked out for whatever reason. So it should be available later, but we have one of our colleagues is kind enough to do some editing for us. So patients' images and names should not be visible on the when you if you watch it on YouTube. I have a hand up already. Joseph, did you have a question or did you accidentally put your hand up? Ah, so if you do have a question, you can go ahead and unmute yourself and ask. I'm thinking he may have accidentally put his hand up. That happens. Happens to me in Zoom all the time. All right, so we're going to get started. So our speaker today is Tom Daw. He has been kind enough to join us from Transplant Pharmacy. So he is going to share his screen and share all of his expertise about transplant pharmacy and things that you need to know about medications.
Up a little bit. All right. So welcome aboard. Thanks for the warm introduction, Janet. Pharmacist Tom. That's what I usually say. Pharmacist Tom at your service on the transplant team here at Mayo Clinic. And today we were going to talk about transplant pharmacy. And I named our presentation today or titled it A Time for Thanksgiving. So welcome aboard. All right. So first up out of the bat, choosing a pharmacy, we want to make a decision before transplant to avoid delays in discharge. And then obviously social work is going through that piece with you on the pharmacies. The specialty pharmacies consistently stock transplant meds, overnight processing and delivery, familiar with transplant meds, and staff are as well. They work with transplant patients, especially Mayo all across the country, types of pharmacies, local retail, mail order, and we really kind of focus on that specialty piece, which are valuable where we can ship, and that unit is specialized in transplant. Insurance or billing, pharmacists must be able to bill multiple insurance plans. And pharmacy must be able to provide cost estimates. So before transplant, you're getting that information all set up before listed, must be in network. Pharmacy choice will depend on your insurance. And then I put on our last bullet point, never let your insurance lapse. Always have meds in your arsenal. If there was ever a snafu, pharmacy could give you some to tie you over. And also social work's always stressing to always make sure your insurance is up to date and have that available with the pharmacy. And if there was ever an emergency type situation, the pharmacy can help out, social work could help out in that. So I put on a little bullet point up in the little bubble. Thank you for insurance. That is so valuable. We couldn't get these meds without it. Right. You want to ask questions. The main thing is each med on your med list, you want to know what it's for. Why am I taking this? How long you're going to take it for? We go over that on our one-on-one visits with you after discharge. On our post-transplant visits, if you forget to take a dose, food or drinks to avoid, side effects, report those in clinic, and also coordinators will have a means for you to, they'll let you know how they want to be contacted regarding that piece. And any interactions, we're always checking for interactions. Types of meds, they'll fall into 3 categories. Your immunosuppressive medications, 3-drug combination, doses may change over time. Medication adherence is very important. That is your lifeline to keep the transplanted organ in your body, and you will be on some forms of immunosuppression lifelong. So for with kidney or pancreas, 2 to 3 immunosuppressants for life. Anti-infective meds, antibiotic, antiviral, antifungal, those are to help prevent infection. As we're suppressing your immune system, a little more prone to those, so we have those available to help prevent as prophylaxis. Anything outside of those 2 categories, those would be miscellaneous meds, such as like a blood pressure multivitamin, things like that. All right, immunosuppressive medications. First up, group 1, your calcineurin inhibitors, tacrolimus, also known as Prograf. The long-acting would be the Envarsus XR, or some patients may be on the cyclosporin modified. Brand names would be Neural or Gengraf. Second class are your antimetabolites. It's either azathioprine, also known as Imuran, or most patients are on the mycophenolate, also known as Cellcept, or the cousin to that, the enteric-coated version, would be Myfortic. Prednisone in its own class, and your mTOR inhibitors, sirolimus, also known as Rapamune, or everolimus, also known as Zortress. So your immunosuppressive, I just put the most common combination: tacrolimus or Prograf, mycophenolate or Cellcept, and prednisone. Those are the typical 3 that we see. And I put on there, thank you, immunosuppressants. That is a thank you, because without them, your organ would not stay in your body. All right. Immunosuppressants, also known as anti-rejection, you may hear those terms interchanged. So here's some things that could occur, not to say that you're going to get it. Tacrolimus, sometimes there's a little potential tremors or little shakes in your hands or feet during the first part of therapy as you are getting used to the med. And when you're on a higher goal range, you're on a higher goal range for that first month. After that first month, the goal range drops. That should tend to go away if you did get tremors. Also, it's usually 2 hours after you take the med where it is the highest in the bloodstream. And then that gradually lowers over time as the clock ticks there. So it's usually not all the time. It may be just transient, but that should tend to go away. Also, too, just because it's listed doesn't mean you're going to get it. Some patients don't get this at all. Mycophenolate, more GI discomfort if you did see anything there. And we maybe taking it with food helps alleviate that. Or we could adjust the dosing frequency, or maybe we go to the enteric-coated version as well. That could be a possibility. We're watching your blood cell counts in your CBC, which is your complete blood cell count, part of your regular set of labs. Prednisone, changes in mood, insomnia, and could elevate blood sugars and blood pressure as well. So your anti-infective meds, antibacterial, we use Bactrim or Sulfa to help prevent PCP pneumonia, and that you would be on for 6 months. If you are allergic to that, we do have some options below that, so that those are possibilities. For antiviral, we checked the viral status of you, the recipient, as well as the viral status of the incoming donor organ. And based off the positivity and negativity of those tests, you're either on one or the other. The acyclovir is for 30 days, and the valganciclovir is either 3 months or 6 months. And then antifungal. For our kidney transplant patients, we use nystatin. That is a liquid, and that is to prevent thrush in your mouth. That is a thrush would be like a topical fungal infection. The nystatin helps prevent that. So nystatin, you're just on it while you're in the hospital during the short stay, and then that goes away. And for our pancreas transplant patients or kidney/pancreas transplant patients, it's a dual organ, we would use fluconazole just for the first month to help prevent any fungal infections. Your anti-infective meds are listed here. Sulforbactrum could increase risk of sunburn, and with our transplant patients, we're always telling you to wear a sunscreen of 30 or higher. We're watching your kidney function. Your liver enzymes are part of your regular lab work. And then increased potassium is a possibility, and decreased blood cell counts, we're watching for that as well. With our antivirals, more so related to the valganciclovir, decreased blood cell counts, we're watching that in your regular set of labs as in your complete blood cell count, also known as your CBC. Miscellaneous meds, these are meds outside of those, the main ones, your immunosuppressant and anti-infective meds. Sometimes maybe taking your med with food will help alleviate any nausea. If needed, maybe we use the ondansetron, which is an anti-nausea agent, which could help relieve nausea. We also have the stool softeners, laxatives listed there to help prevent constipation. While you're on the immunosuppressants, a little more increased risk for reflux or heartburn. So we have pantoprazole or omeprazole to help with that. Insulins are listed there to help with any increased blood sugars. Some patients, when they're on prednisone, their sugars are elevated, and maybe we need insulin to help with that. Blood pressure meds typically seen there, and cholesterol-lowering agents if needed, magnesium to increase your mag levels if needed, and sometimes our potassium levels are a little elevated, and we need an agent such as Caxlite or Lokelma to help lower that. Management of side effects, nausea and vomiting, maybe taking it with food helps alleviate that. Like I said, we have ondansetron if needed. We went over the constipation piece with our laxatives and omeprazole or pantoprazole to help with any reflux. While you're on the immunosuppressants, a little more increased risk for skin cancer. So we want to prevent sunburns from taking place, which could lead into skin cancer. We say wear a sunscreen of 30 or higher to help prevent burns. Also watch those cloudy, hazy, overcast days where the sun could burn through those thinner level clouds and burn you that way. So just be watchful. And also not a bad idea to wear caps or hats to protect the top of your head. Birth defects related with mycophenolate, it could cause this. So what we say is use, and if this applied to, so number one, it would be transplant recipient, 2, women of childbearing age. If you hit both of those categories and it applied to you, they would give a brochure outlining that process in the hospital. And it's either 1 or 2 forms of birth control, depending on the method used, or abstinence, or if you want to have the glorious gift of having a child, then just have those discussions with your transplant team, and they could do an alternative plan for you. Blood pressure, cholesterol, and sugars could be elevated. We have meds available to help with that. And like I mentioned there, the prednisone could increase your blood sugars. We use insulin if needed. And some patients are on prednisone, their sugars are within normal limits. Therefore, then you wouldn't need any insulin in that case. Important points for immunosuppressive meds: take your medications every day and on time. So with twice a day immunosuppression, we go every 12 hours. Typically, we'll use 8 a.m. and 8 p.m. And you want to take your meds as close to those times as you can within the hour to keep nice rhythmic blood levels with your body. You don't want to miss doses. Never stop taking your anti-rejection meds. And that's your lifeline to keep your med or your organ in your body. And then I put, unless specifically instructed, unless they had you hold or told you otherwise in certain scenarios. Be consistent with regards to meals. Either take your meds consistently. So let's say your immunosuppressants, 8 a.m. and 8 p.m., 8 a.m. with food, 8 p.m. with food, or empty stomach for both of your dose times there. Keep it consistent. The med will work either way, but when they're doing lab testing, we want to keep that consistent. Things to avoid: grapefruit, pomelos, pomegranate, star fruit, Honeybell oranges, which would be a hybrid of a grapefruit, and Seville oranges. Regular oranges would be okay. Orange juice is okay. Lemons are okay. Limes are okay. And clementines, max of 6 a day. And the main thing is just in check ingredient labels, making sure nothing has those in it. And then don't add any extra meds without checking with us first. We always say take what's prescribed to you as a general rule. Avoid herbal products, not because we don't like them, it's because they can interfere with and interact with the immunosuppression. We also say teas are in that category too. Avoid herbal teas because they could interfere with the immunosuppression, but regular teas are okay. Your plain teas. Sunscreen, like I mentioned, 30 or higher. And we talked about the pregnancy piece. And take your meds after labs on lab day. So it's always after they draw your blood. Here's some extra tools to help you remember. Obviously, you have your logbook. There are mobile med apps to alert you to take your meds on time. Examples: these first two, these are free, My Med Schedule Plus. You can put your meds in there digitally. You can put your dose times. The app will alert you when to take them too. You can set alarms. You can print it and have it a pocket size. That's kind of nice. And just overall helps you remember to take it. Mango Health is another free app, and that one's kind of neat too, pretty much on the lines of the My Med Schedule Plus. And they also reward you too with good habits, nutrition, taking your meds. Sometimes there's rewards in there, even gift cards. So kind of a neat thing with that app. And MediSafe medication management. There's Dosecast, and My Pill Reminder app. Smart bottles, those track when you take your meds and knows how many pills are remaining. Some examples: AdhereTech, Pillsy, which has an app available for those. Some of those smart bottles, those do cost money as well as the apps, but an option. I usually, if I was going to do an app free of charge, I kind of like the My Med Schedule Plus and the Mango Health. Virtual assistant, of course, there's Alexa or Echo as well. And then number one reason patients may have, they didn't take their meds is because they forgot. And so that's why these tools are always reminders: your pill box, your caregivers, all those, and your maybe extra tools help you remember to alert you to take your meds. You can also add alarms to your watch or cell phone as well. Other options along with your pill box and your logbook. And this brings us right into this slide here. Upper left-hand corner, that's a pill box, 4 slots a day, 7 days a week. Specialty pharmacy would provide you with one of those after transplant. We also have translation, our wonderful interpreters, and alarms to your watch or alarms to your cell phone as well. And as I put on there, we thank you for the extra help. This is a reminder to help you remember to take them. So we are thankful for that. Low vision resources. You could ask the pharmacist to prevent larger print label. Mark your med bottles with rubber bands or braille. If you did that, check with pharmacy, because I've done this before where we needed to assist some patients with this. We would have a braille gun, and then what we did was we put that on the bottle and had the patient feel that out, making sure everything was okay. We did a coding system, and what you can do is, like, patient can say, I want my tacrolimus 1 to be like T1, and so on and so forth. And so patient and pharmacy are on the same page in the chart. So if they did it that way, that would probably work. You could check with the pharmacy on that. Maybe if you're doing a pickup, that might work better, since that way you can feel it to make sure everything's okay before it's released to you. Place light close to labels you're trying to see. Obviously, magnifying glasses or reading glasses are options. And visionaware.org, managing meds in your everyday living tips. Important points to remember: never stop taking your meds or change dose unless instructed by team. Inform your dentist, other physicians of the meds you're on. And if they prescribe something, always a good idea to have that checked out with us. Allow plenty of time for refills. I always say order your meds a good 7 to 10 days ahead of time. The specialty pharmacies will reach out to you, but I kind of use that benchmark of the 7-day mark, where if you haven't heard from them, to call them just to make sure nothing's happening at the last minute for getting your meds. Notify coordinator transplant of any side effects. We talked about that, reported in clinic. I want to go back to the refills. If your meds have refills, you can call them to the pharmacy. If it's out of refills, I like to say contact your coordinator and they can send the script to the pharmacy. It's a little quicker that way. And with updates, let's say like with your tacrolimus, also known as Prograf, they will send the updated dosing to the pharmacy. But let's say it didn't get sent and the pharmacy didn't have it, then the coordinator could assist with that as well. But the pharmacies a lot of time will have these on profile. And so you can, when you're going over your dosing, make sure that they have, and they're filling the med that update or corresponds with that prescription. And as I mentioned, don't take anything without letting us know first. And this brings us to thank you to all the members of the multidisciplinary transplant team. There are so many pieces of this multidisciplinary transplant team. I'm thankful for everybody. It is a family, and working together with all you, we are all helping each other out for the common goal, for the betterment of you, patients, and assist the caregivers at all as well. So appreciate you so much. A warm, heartfelt thank you to everybody for all you do. And most of all, we appreciate you, the patients, and your caregivers, working together. We are all a team here. It's not like we're here and you're at home and we're all a part of this. We want to help you out to take your meds, help you out for caregivers, and patients and caregivers work together at home. It's not all caregivers to, as we're doing pillboxes, work together on that. And we can also help with that in clinic if need be. So a heart, huge thank you to our patients and caregivers. You're a prized possession, and we are always here for you. And then best wishes on your transplant journey. And I thank you once again so much for all you do. Here's my references and any questions that anybody have.
Yeah, so we have a small enough group, we can open it up to questions. Emmanuel, do you have a question? You want to unmute? So you can either, there you go.
Yes, what about the medication I'm already taking? Do I stop taking them? Because look like all the medications they're gonna give us is the stuff I'm taking already, like blood pressure medication, and I'm taking acid reflux medication, and I'm taking something for phosphorus.
Oh, okay. So are you, you must be, correct me if I'm wrong, you must be listed waiting for transplant or?
Yeah.
Okay.
Uh,
So yeah, what we do is keep taking your meds as you are doing so now.
okay.
That will slide up to transplant. And then once transplant occurs, inpatient's going to give you the meds in the hospital. But
No.
after transplant, you're going to get a brand new med list. So just follow that new med list coming out of the
Okay.
hospital. And yeah, some of those might roll over and you're going to be on them again. But it's not like you're taking this med list now plus all these other meds. They'll factor that in. And so basically, I always say, once you're transplanted, just take your new med list. Yep.
Okay. Okay. Thank you.
You're welcome.
We have a question from Elizabeth in the chat. She asks, as far as pregnancy, is it better to not choose pregnancy after transplant?
That is up to you. If someone wants, so basically, we just don't want a birth defect with a child with a mycophenolate. So that's why there's protection involved. But if you don't want to use birth control, then it's abstinence. Or if you want to have that gift of having a child, then we could switch that agent out. And then that way it's good for that pregnancy piece, family planning piece, and using immunosuppression at the same time. So it's really up to you. And then if you wanted any decisions on moving forward with that, you can check with us, the transplant team.
Any other questions? And I might go ahead, what I think I want to do is I'm going to go ahead and there is actually a poll that we'd like everyone to do. So I'm going to send that to you right now while we're waiting on more questions. So you guys should be seeing that on your screen. Just a little kind of post test to see how we did here today as far as covering some information. So everyone can complete that as you see it pop up on your screen. Tom, I actually had a question.
Yeah.
We were talking about the mycophenolate and the potential for birth defects. And I think that was a question Elizabeth was having as well. But I guess for my question was, I'm wondering, is that risk only for the patient who is ingesting it, or is that a potential risk for our caregivers as well, like just handling it? Like if we have a female caregiver who is handling that medication to assist a patient, is that a risk?
I would say if it's consumed, yeah, because, well, let's put it this way. Usually what we'll do, because this applied if, like when we've done liquid before, we would say wear gloves if it's a caregiver handling it. But if it's straight up tablets or capsules and you're not, it's intact, then that should be okay. But for the patient piece, yeah, that should be It's more so with the patient, the female taking the med if they're childbearing age. Yeah.
Mm-hmm. Okay. What other questions do folks have? I'm kind of scrolling through everybody's picture to see if I see anybody. And feel free again if you don't want to ask your question, you can always throw it in the chat too. We're happy to take questions that way.
Close tomorrow, the shop.
Can I drink pineapple juice? Is a question that just popped up there, Tom.
Yes, pineapple's okay.
Pineapple, nice. I like pineapple juice too. Everybody's thinking about what food and drink because Thanksgiving being tomorrow, right?
First, she didn't think of that.
Oh, no, makeup is real. That's
Any other questions?
you do fill it. And I think this is
Sir, no.
30 after your labs are
I
drawn.
have somebody that's, there we go. All right, one last call for questions. Looks like we got 10 out of our 14 folks who have completed our poll. So if you haven't done it yet, if you wouldn't mind answering those questions that you should be seeing on your screen, we certainly appreciate it. If you have any suggestions for future classes that you'd like to see us offer, feel free to throw that in the chat as well, or you could certainly unmute and share. We're always open to suggestions as far as what education you'd like to receive. I see a question from Elizabeth asking about a caregiver. I'm not quite sure if you, as she's asking what would happen if a caregiver were to pass away. So I'm not sure if you mean like before your transplant occurs or if you're or after transplant. I'm not exactly sure the question you're asking. If you want to unmute yourself and ask, or if you want to clarify a bit. But in general, of course, we keep caregiver plans up to date. So if there's any change in a caregiver's health status or their availability, we certainly need to know that because we would want to be talking to you about updating a caregiver plan if there's any changes with your caregivers at all. But most of you all know that you need a primary and a backup caregiver. So we like to prepare as much as possible, we're really proactive. So if anything happened with a primary caregiver, the idea being that you have that backup caregiver that can fill in for them. But yeah, if you have specific caregiver questions that maybe I'm not answering, feel free to call us in social work too. We're always happy to talk to you, your social work team. All of us are available via phone call. So just give us a call, leave us a voicemail, we'll return your call, okay? Any other questions? All right. Well, I want to thank everybody so much for joining us today. And of course, a big thank you to Tom for this wonderful presentation. If you guys think of any other questions and you want to shoot us a message, you can always do that or just reach out to us. Your transplant team's always here for you. And grateful, of course, for all of you. And we'll see you again next month.
All right. Happy Thanksgiving, everybody.
Yes,
Appreciate
happy
you.
Thanksgiving.
All right.
Happy
Alrighty.
Thanksgiving.
All right. Thank you.
Take care.
Take care. Thanks so much.